Hello and welcome to Dil Ki Recipes. I am so excited about this episode because today we have a very special guest, and I know that so many of you have asked for this. And this is a topic that needs so much more awareness and education. I want to welcome Durriya Shamsi to this podcast. Durriya, welcome and thank you so much for taking out time to be on this podcast.
Hi, Sheeza. Thank you so much for having me.
You're a board certified behavior analyst and you've worked with children, you work with adolescents, and so many adults with neurodiversity. And I am so excited. You are at the tail end of completing your doctorate in clinical psychology. That is pretty amazing.
Thank you, Sheeza. Thank you so much. I'm truly pursuing my passion. I love working with the kiddos and their families. So it's truly my honor.
I think we just need so many of you. We have to clone you in our community. Durya, I want to jump in because I have so many questions, and a lot of times it's so interesting. When I work with families and couples and I am referring them out to work with BCBAs, our community doesn't have that much awareness that, this skill is so specialized. Even when I'm trying to explain to them that I'm not trained to work in this space, sometimes I know they get annoyed and they feel like, okay, why aren't you working with my kid or the adult? So, what I'd love for you to do is start us off with really giving us some perspective on autism spectrum and also the professional training, because I know there's so many levels.
Sheeza, autism is a different way of experiencing and interacting with the world. It affects how a person communicates, understands others, and processes information. It truly is not an illness to be cured. I think that's a very important point. It's a neurodiversity. It's a neurodevelopmental difference, meaning that the brain works and connects in unique ways. So, everyone on the autism spectrum is different. Some people require daily support, and others live independently and they thrive in their own path. It truly does not mean a lack of intelligence, emotion, or capability. And also, the word spectrum reminds us that autism looks different in every person. Autism is a different, not lesser way of being human. And then you had asked me about, the training that one does to become a specialist in working with this population. I got my master's in special education, and then I worked to get my board certified behavior analyst certification. And in the state that I work in, we also need a licensure. So it's a licensed behavior specialist. You have to jump through those hoops and get that training and get that supervision and get that work experience before you can actually call yourself a specialist who's working with people on the spectrum.
We just need so many of you, Durya. Welcome to Dilki Recipes on your favorite social media platform. Hi, I'm Dr. Sheeza Mohsin, executive coach, relationship expert, and your coach in this virtual space to support you and your Desi family in America. If you identify as being a person of color, a minority, and having some form of bicultural identity, a major goal of putting this information out is to help you realize you're not alone in this journey. If you identify as a Desi with cultural roots in Pakistan, India, Bangladesh, and surrounding areas, trying to meet your life and relationship needs and desires while embracing some beautiful elements of your cultural heritage, Dilki Recipes is for you. If you don't identify as a Desi, but have a warm, loving, human being kind of disposition and you want to better yourself, I think you'll find some good stuff in here as well. So let's go on with the show. I want to focus our attention to the South Asian community. According to the CDC, the number I found was 1 in 36 children in the US are diagnosed with being on the spectrum. But in South Asian families, there is consistently noticed late diagnosis and underrepresentation. And also, a lot of studies show that South Asian parents are feeling very socially isolated when they're supporting kids. and their diagnosis. And then moms are carrying a lot of that burden. There is lack of education and awareness. So the impact on the family system, depending on where someone is on the spectrum, there's so many elements. As you do your work, and you've been doing this for quite a few years, Durriya, what do you notice when you come across people specifically in the South Asian community?
Yeah, so current understanding of autism in our community, I feel is still evolving. There is a growing awareness, especially with, younger parents, with educators, but often there are so many stereotypes and generalizations that are perpetuated. And these generalizations can range from assuming that all autistic children are nonverbal, or they're not able to succeed academically or live fulfilling lives, or the other side of the spectrum is they're savant. Again, like I had said before, autism is a spectrum and everybody has different strengths and different styles. And I think probably this might be a good time to also touch on the stigma or the secrecy that is so entrenched in our South Asian circles. And I think there's so many reasons for the stigmatization, but I think it stems from that cultural facet of being so conditioned to view anything that diverges from the norm as unacceptable. Our social fabric is so deeply woven with expectations about how people should behave, how they should communicate, how they should relate to each other. And when someone expresses themselves differently, could be through a unique pattern of communication, could be sensory processing, emotional regulation, it just unsettles those expectations. That is externalized as discomfort, which in turn can lead to avoidance and judgment and labeling. And also, I feel, autism has been discussed more in deficit-based terms and as a disorder, as an impairment. And I think this framing implicitly positions the autistic individuals as lacking something rather than having a different cognitive style. And I think that's what the neurodiverse movement is trying to counter this by emphasizing difference, not deficiency.
Neurodivergence is something that we're just not used to, familiar with. And as I notice our community, I see a lot of wanting to be perfect and that perfect reporting and whatever that means for someone. Tell me a little bit about how you educate families on managing that stigma.
Yeah, that's such an important question, Sheeza. There's so many layers to this. So, initially, when that diagnosis is provided for the child, I think parents go through, different stages of grief. There's shock, there's denial, there's guilt, there's this internalized shame. Like, did I do something wrong? Is this my fault? Whose fault is this? So I think the first thing is providing that unconditional support towards the parents. I think that is very reassuring. And then coming to a point where professionals and educators can help with that is trying to shift that focus from fixing the child to come to an understanding of the child. With autism, definitely, as I said, it's a spectrum. We definitely see behaviors. We see very intense behaviors. So I think that's where you need that early intervention. You need to get the support of professionals. You need to understand what are evidence-based strategies and interventions that you can utilize for your child and for your family system. One important facet is understanding that we have to separate the behavior if the child is demonstrating problematic behaviors from the person and really hone into what is this behavior communicating? Why is my child doing what they're doing? Rather than labeling it as defiance or non-compliance. As a BCBA, as a behavior analyst, my impetus is to explore that function of the behavior. So I go in and I try to see what's going on, what's the context, what are the triggers. We move from judgment to curiosity, and then we build from there. We have the early intervention team with us, and we work on behavior skills. We work with a psychologist. We work with a speech therapist, an occupational therapist, whatever the need is, we try and provide that. I always advise the families I work with to seek support for themselves.
That's beautiful, Durriya. Thank you. And I will dabble into the family system and the impact on the family in a minute. I have some questions, and I made a list, and one of the things that I want to definitely ask your perspective is about kids who are high functioning. So a lot of times kids who are high functioning and verbal. So now there is a little bit more awareness, people know, and what I've noticed is that if you know, then you treat and you interact better. So an example, my kid who said some behaviors about his friend that were really upsetting or annoying and so forth. And I had no idea. And we had a conversation. And I was like, just talk to them. And then a few days later, he found out that this kid is on the spectrum. And that's why some of those behaviors, maybe repetitive behaviors and so forth, his demeanor changed. And I think that expectation helped him be kinder, because kids on the spectrum who are high functioning, I feel sometimes it's more difficult for them because the expectations are to conform to how a neurotypical kid is functioning versus a neurodiverse kid. So what are some tips you can give that really can help people say, okay, this is how I need to be kind before I understand or before I, feel otherwise?
I know that this is such a pain point with so many of the families that I work with. They're torn between divulging to the whole world, letting everybody know, but they're also concerned about that stigma. I would love to see maybe in the schools and maybe in our community centers,
Absolutely.
and as South Asians, maybe in our mosques and our, temples, have these open conversations and explaining autism and neurodiversities in a more age appropriate language, teaching the children that this is a neurological issue. The only thing is the brain processes information a little differently. Yeah, and sort of celebrating this neurodiversity. I have worked with siblings and with families where I've, written social stories and we've had conversation, and I think that has helped. But Sheeza, I think it behooves, I'm so glad you brought this up, but I think it behooves all of us to have those conversations with our children about kindness, about acceptance.
Maybe it's my bias because I see children in the community. I think the children are not the issue. I feel children are so much more aware now. They're just so with it. And, I see children of my clients, I see children in my own family, very aware, don't need any education. So I think something's being done right. I think at a community level, maybe the grown-ups need more information, because that's where the issue is. I feel like some kind of workshop that people like you could do in a mosque, in a temple, in a community setting, that would just make people aware, okay, this is just something you need to be familiar with. And actually, it's your problem that you're not as informed. And now that you are, you should do better and behave better and be kinder.
It sort of harkens back to that, that broader picture of just general like mental health stigma that is so prevalent in our South Asian culture, right? Like, we do not want to talk about psychological issues, seeking psychological support. Therapy is not considered important. There's just so much stigma that is associated. It could be like depression or anxiety or, personality issues, or whatever the issue is. There's such reluctance.
Definitely, we have some work to do. I'm definitely seeing a lot more hope. Not all families are the same. I see a lot of growth in our community as well, but we still have a long way to go. So I have a specific question. Can you talk a little bit about early intervention and diagnosis? A lot of times, parents who delay diagnosis, as I understand it, are putting their kid at a disadvantage because the interventions and the support and the learning can start quickly.
So, I will talk about the biology of the brain for this facet. I think, the brain is developing when the child is young. The brain is flexible. It is amenable to change. It is pivotal that we work on providing our child with the skill set. The sooner we start, the less stigmatizing interactions they're going to have, the more support they will have, the family will have more support. And parents think, let's delay this, maybe the kid will get better. That's not happening. With autism, with other neurodiversities, there is a need to start working as soon as you get a diagnosis, because this will facilitate a better life for our child. By early intervention, what I mean is getting a diagnosis, getting the support of different specialists, which could be a psychologist, speech therapist, an occupational therapist, and having that cohesive teamwork together to support the child. I truly believe in a team approach.
Wonderful. Could you give us like a high level overview of the levels, the symptoms that typically would classify someone in those like level 1, level 2, level 3 is what we hear?
So these are all behavioral facets that we're looking at.
Okay.
As you know, there is no blood test you can do that will determine, if the child is on the spectrum or not. So if you see your child struggling with communication differences, there's social and communication differences. Some children are nonverbal. Some children can be conversational, but can still be on the autism spectrum. Some children have echolalia, which is, they echo everything that they say. That's sort of like the communication differences. The social facets are more not having a difficulty with the back and forth conversation, having limited eye contact, trouble understanding nonverbal cues like sarcasm or tone. There is more a preference for routines and familiar interactions. With younger children, we see like restricted play, or we see the lack of play. Actually, there could be some repeated movement. There could be also like strong attachment to certain topics or interests. There might also be some layers of rigid routine. The children experience distress with changes or with transitions. Such a huge spectrum, but these are some of the things that we see within the different levels. Some children are hyposensitive, some are hyper. Not all, but some children, close their ears. Maybe some children craving like a deep pressure. And then, as they get older, we see more emotional and problem solving difficulties. Some children may struggle with emotional regulation. There could be issues with attention, with planning, but also there may be a lot of strengths. There could be strengths in memory, in pattern recognition, in visual thinking, in empathy. It's sort of hard to delineate the levels, but I think this is sort of a synopsis of what autism may look like.
So I'm going to bring you back to talking about the family. Can you share what you've noticed in the families and the kiddos you've worked with or the adults you've worked with? What are some of the challenges that the family members in the system experience?
Yeah, I've noticed the strength of so many of these parents. It's that kind of strength that shows up every day in small, consistent acts. I see these parents, advocating for their children even when they're exhausted, learning new ways of communication, building on the small wins that their child is experiencing. With that, I think a diagnosis, which requires so much work and effort, it affects the couples. It affects that dyad with the husband and the wife. Like one person can sort of dive into that research, other person can withdraw. I think again, it's really important that these parents get the support of therapists and get the support of family members, and also name their emotions. Say, I'm scared and I need time, and say that clearly to each other and to the family. As I said, these parents experience stress, fatigue, people who are judgmental. So it can be a lot. And I think with siblings, you had mentioned siblings as well. Siblings, I think, also have a lot of onus on them. They may feel protected. They definitely have an increased sense of responsibility. And also sometimes their needs are overlooked because the parents are so sort of entrenched in the work that they are doing with their neurodiverse child, and they struggle with like increased expectations.
So I support couples and families who may have a kid on the spectrum, and I see all kinds of dynamics. I see one parent over functioning in the support and burning out and then being resentful. So I see marital strain all the time. So I'm very protective of my couples where there is a diagnosis, because I know how fatiguing it is for whichever parent. Having the family to come in so this couple can actually get a break to spend time with each other and reconnect, not just around the support of this kid, but just notice each other becomes a big thing that I see. Even in neurotypical families, it's the kid that needs more support that gets more attention. And then the kids who are functioning in a way that needs limited support also end up getting less time or attention from the parent who may have limited bandwidth. Talk about extended family and give
tips, if you can, on how should an extended family member, it could be, grandparents, aunts, uncles, how can they support their family member and the family?
And again, I sort of talk about, I'll just take a minute. I'm working on my dissertation these days, and I just read a paper which talked about systems of silence in our community. And I think sometimes I've seen that in the South Asian community where we just think not talking about something will make it go away. No, talk about it, name it, show up, listen. For extended families, I would say, please show up, please support them. Instead of saying, let me know if you need anything, ask a specific question. Would it help if I babysat? Would it help if I got you groceries? Send me a grocery list. I'll go get your groceries. And really including them in everything. Inclusion over pity is key. Let's understand where the family is, where the parents are, where the child is. It would be helpful if we could validate and affirm those emotions before we embark on providing them with the education we feel that they need. So if the family just wants to talk and vent, be that listening ear for them. I think that is so important. I also see toxic positivity and saying, oh, everything will be fine. And, you are just worrying for no reason. Or their comparisons. Oh, that person is managing her child so beautifully. You should learn from her. Please no. Everybody is different. Everybody deals with their challenges in their own unique way.
I look at it as a dysfunction in our community that everybody thinks, it's like just because you've reproduced, you are now a parenting expert. Just because you are married, you are a marriage expert. So a lot of times, this whole advisement culture versus the support culture and the comparison culture, those are all toxic behaviors that are sometimes rampant in how they're noticed in our community. One final question that I want to ask you: how do you think mental health professionals, other professionals, our community can amplify, or even media inclusion? Because I hear this a lot, feeling excluded so many times. So please share some examples, because I think we have a lot of growing up to do in that space.
There is a lot of othering. There is a lot of stigma. There's, that public stigma, that internalized stigma. This is a process, right? It's going to take a while. And I think what we can start by doing, which I think you, Sheeza, truly are undertaking this. Your work is so important in this space. We are using inclusive language. We are normalizing neurodiversity in everyday conversations and representations. We have to keep talking about it, keep talking to our children. We model behavior for our youngsters. And I think you made a very important point that our youngsters are definitely more empathetic and understanding and inclusive than we ever were. We are going in that right direction. Modeling empathy for our children, a smile instead of a stare to somebody who is struggling.
For someone who is listening to this podcast, isolating and not having the support, the emotional support from their family as they are supporting a child or a family member on the spectrum, what is something you'd like to say to that person?
I think the first thing I will say, Sheeza, is I see you. I hear you. I'm standing right next to you. Please know you can reach out. This is a pivot. You had certain expectations for your child. It's the same child. The journey has probably changed direction, but it's that same child. And I truly believe, Sheeza, that every child on the spectrum is teaching us something. We just have to be open to receiving that communication.
I just want to say thank you so much for making time to be on the Dilki Recipes podcast. You have no idea how meaningful the work that you're doing is and how important it is for creating more awareness on this topic in the South Asian diaspora. So thanks so much for taking time out.
Sheeza, thank you so much for having me.
Please remember to keep listening and watching as part of your weekly self-care and learning ritual. You know there are lots of commonalities in our lives, relationships, in our joys and struggles. And my hope is that this material will help you expand your perspective, give you some clarity on how to think about things.